Hi, this is Ruth Hanston, and we're talking now about the sixth best practice of the Relationship and Results-Oriented Healthcare 10 Best Practices. So the sixth best practice is communicating the patient's 4Ps to the team. And since you've already had your healing moments, your time with your patient and family to hear their priorities, hear their story, and really understand what's most important to them, now it's time to make sure that you have been able to update the members of your care team. Maybe you're working with a partner RN, or certainly you want to talk with the assistive personnel that you're working with and make sure they know the updating of the patient's goals, short and long term, and also what the plan of care is in case there have been some changes. So what this might look like is perhaps at shift change you were working with a patient with COPD, and also perhaps they'd had a surgical intervention. And so at shift report, what they'd been working on a night shift was they needed to get the pain level down to, it was an 8 and they wanted it down to at least a 4, and they wanted to be able to breathe well enough to sleep during the night. And maybe they got pretty far on achieving those goals, but they were still working on the pain and the breathing at this in the shift report at 7 a.m. Now, when you've had a chance to really sit at the bedside alone with the patient and talk about, what's really on their mind, what their priorities are, what you'd want to do is to be able to find out what it is that's on their minds and update those priorities with the folks that are working with you. So you might go to your assistive personnel and say, before you go to break, I wanted to make sure that you knew I did talk to Mrs. Jones, and she's breathing better. Her oximetry shows that she's doing well there, and she was able to actually get up and ambulate to the bathroom with help from me while I was in there. But one of the things that's really on her mind is she's concerned about her placement because she's been readmitted several times. And so the social worker, I called the social worker will be on her way in and will also be calling and talking to the family. So that's really on her mind, and I just wanted you to know that. Her pain is down to 3 now, and we're doing well with the breathing and the pain, but her main concern now is this whole social situation, discharge planning. That's what that quick overview might look like when you updated the members of your team with the patient-family goals. So again, as we've finished our conversation, our healing moments with our patient, now we're going to take that information and make sure that the members of our care team at the bedside are updated on the patients and families' 4Ps, purpose, picture, plan, and part. So that would be their priorities, both short and long term, and the plan will be informed by that. Thank you for joining us for Step 6 of Relationship and Results-Oriented Healthcare's 10 Best Practices.